Is Paul Ryan's approach dead on arrival? Is it the wrong argument to be having?
Well, I think he's wrong to say no matter what happens and no matter what the circumstances are, we won't touch taxes. I've already said, you know, I wouldn't be against lowering the corporate rate as long as you didn't lose the money, but making sure everybody paid something. But Ryan's position is whatever tax rates exist now are perfect as compared with anybody paying $1 more. The only way to make the tax system more perfect is to have it produce less revenue. And I think that's wrong. But I don't think the Democrats can say the same thing about Medicare, Social Security, or anything else. The other thing is, I just think his Medicare proposal is, on the merits, wrong. That is, there is no reason to believe that if you cut a check to all the people on Medicare, that all of a sudden they'll have market power and they'll drive down Medicare costs and they'll be better off. What in all probability will happen, particularly if they dismantle some of these other cost controls, is that medical costs will continue to go up and older people will use less, get sicker, and die quicker, or they will be poorer because they'll have to spend so much of their money on health care. In other words, the problem is rising medical costs. Medicare is a part of a whole health care system that has a toxic rate of inflation and a spending base today that's not sustainable. It's also one of the major reasons people don't get pay raises. Employers that try to provide health care to their people find in a down economy that it takes whatever increased revenues they allocate to labor just to pay for the health care premiums, and they got nothing left to give pay raises. So I applaud Congressman Ryan for making a suggestion, but I think on the merits it doesn't work. And that's really what I hope the lesson that we'll draw from the New York election, not that we can't talk about Medicare and we have to tippy-toe around, because we have got to have a system that brings health costs in line with our competitors.